November is Pancreatic Cancer Awareness Month, a disease that is often a death sentence.
But there is promising research taking place at University Hospital's Seidman Cancer Center that may be a game changer for some.
Senior health correspondent Monica Robbins explains.
Heather Sanderson came home to Ohio to take care of her parents. Little did she know that decision may have also saved her life.
I had just a dull toothache in my stomach area, and it would last for maybe a couple days and then it would go away.
The pint-sized PE teacher is a mother of 5 grown children and a CrossFit dynamo. She can handle pain, but this was different and getting worse.
And then finally, it just got to the point where it hurt really bad.
In April of 21, a CT scan found a mass on her pancreas, one of the most lethal types of cancer. More than 62,000 Americans diagnosed this year, nearly 50,000 will die. Heather turned to faith for strength and comfort.
There was no fear. I was not scared. And I know that may sound kind of bizarre, but I really had a peace. And it's just I guess, to quote the Bible, it was a peace that surpassed all understanding.
But it would be a fight. Heather's oncologist at UH Seidman Cancer Center would not tell her the stage of her cancer, only that her goal was to get to surgery, but it wouldn't be easy.
I went through 6 months of chemo and a month of radiation, and then you have to take about 6 weeks off, and then you are ready for surgery.
Heather agreed to add a secret weapon to her treatment, a clinical trial called Case 2218, testing an experimental drug called CPI 613. When combined with chemo, it targets the mitochondria, the energy source of a cell. It poisons enzymes to kill cancer.
They said it gives me a 10% better chance of making it to my goal. And he asked if I wanted to do it, and I said, well, I'll take 10%.
It's involving the blood vessels to try and shrink the tumor so that we can safely remove it. And that was involving a different metabolic modulator combined with chemotherapy.
During 6 months of chemo, she took control, cut her own hair, and continued CrossFit 5 days a week.
I would go 8:15 every morning. It gave me a reason to get out of bed in the morning. Were there mornings that I didn't want to go? Of course. It's not just the physical aspect, it's the community aspect.
After chemo, a month of radiation followed, finished Christmas Eve last year. In February, she made it to an 11-hour surgery to painstakingly remove the tentacle-like pancreas tumor. Her mindset, just as important as her treatment. Depression common with cancer, so UH is studying that too.
Depression is more common in patients with cancer, and it's more common in patients with pancreas cancer than any other cancer type. And if we can reduce the incidence of depression in our patients, we actually will be able to secondarily reduce depression in their providers, and it can also even improve survival.
Heather's reason to get out of bed, her family, workouts, support system, and determination got her through the bad days.
I really felt from the very beginning that, this is not going to take me down. I'm going to beat this.
And she did. Monica Robbins, 3 News.